Welcome back. If you're just joining us, this is Breakfast Daily, and now it's time for us to get into the health segment, a segment that helps us enhance our knowledge and well-being. So today we are going to be navigating a topic that is actually very important to saving lives, and it's also a crucial act of kindness, and that is blood donation. And today we are going to be navigating the topic why you should donate blood. And obviously here with me is our resident doctor. I call him our resident doctor. Dr. Kelvin Owusu, a wellness consultant and from Violet's Medical Center. And we also have Sophia Mellis Blankson, Deputy Chief Donor Recruitment Officer at the National Blood Service. And lastly, we have Ni Abladi Amisa, representing the Kwabinya Traditional Authority. Welcome.
Thank you.
Welcome. Welcome to the show.
Thank you. You're looking great.
Thank you. You're looking ravishing too. I love your smile. Your smile makes me happy. All right, so Dr. Owusu,
yes,
why should we be donating blood?
Well, I mean, blood is not manufactured, and it can only come from another human being. So we need to donate blood because you never know when you yourself might need some blood, in the event of an accident, or more commonly, a pregnant woman goes to deliver and has issues of blood loss, which is very, very possible.
Right.
Postpartum hemorrhage is a very real thing we are dealing with. So if the blood bank is lacking resources, which is blood, it is challenging for me as a healthcare practitioner and for you as well as a potential patient. So yes, we all need to be donating blood. And thankfully, blood is something that our body is manufacturing all the time. So give off a little every so often, and then we can save so many lives together.
Right. So there are many fears and misconceptions when it comes to donation of blood. What should we know about that?
I mean, I like that you said misconception, because really a lot of them are myths or, half knowledge that has been propagated over the years and has become kind of established. So people have a lot of reservations about blood donation and the fact that the blood is going to be used for one ritual, another ritual,
Oh, wow, rituals.
Oh, yes. People are very intimately, they keep their blood very close to them, But what we are trying to, with education, the word is going out there, and increasingly we are getting more people coming out to donate, but we need a lot more. So that's why we are here today to educate some more about blood donation, because it's really, really, really important. At the point when you need blood, nothing else can be used. Or if anything is even used as a substitute, it can only go so far. We need blood to replace blood, so it's important that we all get into the habit of, donating blood every now and then, so that the blood bank is always, stocked and have blood available to share when that time comes.
Right. So you just talked about the blood bank, and there was a story one time about blood shortages. When that happens in the blood bank, how does it affect us? Or how does it even affect the medical system? So
say, somebody was crossing the road and a car knocked the person down, and he or she developed a femur fracture, a broken thigh. Now, you can actually lose half of your blood into your thigh when there's a fracture, and they rush you to the hospital right now. We need to get you 10 units of blood. If there's a shortage at the blood bank, how do we get those 10 units? So you are probably going to die because there was no blood in the blood bank. And so when we talk about the blood bank needing to have a stock of blood, we cannot emphasize it enough.
Right.
A pregnant woman goes to deliver, and then after delivery, she's pouring blood. I have actually witnessed a case where, I was involved in a case where the woman needed to be transfused 20 units of blood overnight.
Oh.
You see, so that's how dire the situation can be. If it hasn't happened to you before, it doesn't, it's not personal, so you don't understand it. But when you have been there, you've seen it, you can understand why some of us are passionate about blood donation. It's very, very important.
Right. Sophia, I'll come to you right now. So he talked about pregnant women, but what types of patients actually need, blood from blood donation, blood banks, basically?
Okay, thank you so much. So I would want to point out that we have two names. One is transfusion, one is donation. Donation is when the person is giving out blood, and transfusion is when we are giving the person blood.
Right.
So I have categorized the users into four. We have patients who, because of trauma cases, accidents, have lost within the shortest possible time. They have lost a lot of blood. Okay. Then we have patients or people who are going through various degrees of surgeries. They will definitely need blood. So most of them are maybe they have they have planned the surgeries. But those emergency cases are also there, and we need to critically look at them. And then the other two categories, some of them are able to make their blood, okay, but then the blood is not so good, okay, so it's a condition that they have. And so when they are making the blood, like the sickle cell patients, okay, they'll make the blood, but then the blood is not working for them, okay. And then the last category of...
The blood is not working for them.
Yes, they make it because it's a condition, it's a condition, okay. Whilst all of our cells are circular in shape, theirs is sickle in shape, and so it tends to bring us other complications.
Right.
That is why during some times seasons, their cases are very critical. If they don't get blood, it's quite deadly. Okay,
right.
And then the last category, they are not able to make their blood at all. The various cancer cases that we have. Okay, and so all these category of patients, at some point in time, some of them are very emergency, if you don't get the blood there and then, something will happen, and you and I know what will happen. Right, and they happen to be our siblings, our friends, and then people that we know. Right. We are all in the same society, and that is why we are here today.
Okay. All right. So, Dr. Owusu, as a medical expert, from a medical perspective, what are some of the health benefits in donating blood or being called a blood donor?
Well, I mean, I think the benefits are more psychological and social, because when you donate blood, you feel good. You are helping society, yes, because every pint you donate, they can fragment the pint into various medical products, which can actually save multiple lives. So one pint, they say, can save 2 to 3 lives. In fact, sometimes more, especially when it comes to children. So you feel good that you are helping society with your blood donation. So that's the biggest benefit. There are some other benefits as well, but they are minor. The major benefit you get from donating blood is the feel good factor. The fact that you are donating something that cannot be manufactured anywhere else. You are the only one that can give the blood to save another person's life.
Right. So blood types and compatibility actually plays a very crucial role when it comes to donation of blood. So how does that work?
So it plays a major role when it comes to transfusion of blood. Every blood type needs to donate.
Okay, it plays
when it comes to giving the blood. So that's the transfusion.
That's transfusion.
So basically, you have to be transfused with the blood that is compatible with what you already have. So let's say you are O positive. Ideally, you should receive blood that is also O positive. Of course, there's a universal donor who are the O negative, so they can give blood to anybody. There's a biochemical explanation why. But generally speaking, if you are A positive, B positive, A negative, whatever, you should get blood that is the same type. So this is why everybody must donate, because we are all not one blood group. So if you come in with an emergency and your blood group is, say, O positive, there needs to be enough O positive blood available so that we can give you what you need. If somebody is B positive, they also need their blood to be available. So if I'm the only one that donates, it means that only my blood type will be available.
Yeah.
You see. And I did mention that there's a second benefit. Let me just chip this in. I'm sure Sophia will back me up. If you're a blood donor and you need blood, obviously, they will try and make sure that they can support you with some blood. So everybody needs to be a blood donor so that there will not be any issue. But of course, the blood cells will
try and
support
you with some.
Yes, because I mean, if you are coming to collect blood and you have not donated before,
ever,
and me, I've donated 10 times, who should they give the blood to? You see, so be a donor so that we can all avoid these sticky situations. I'm sure Sophia has more information on that.
So you see, Dr. Kelvin, this area is very sensitive.
Yeah.
Okay. What we encourage is that if just 1% of Ghana's population should be donate blood regularly, we wouldn't need to call your relatives to come and donate for you if you need blood. Okay, that is why we encourage that. And like he said, we have various blood groups and we all donate. You can go to a population, get about 50 donations, and then out of the 50, the negatives will be like 5.
Yeah,
all together.
I was going to ask that.
Yes, all together. So it's so minute, and they are also in the community, and so it means that the more we donate, the more we get all the blood types, and the more a lot of people will get out of the hospital.
All right. Okay. All right. So let's talk about what's going to be happening this weekend. Dr. Owusu, can you give me more light on that?
All right, so I mean, this weekend, myself and the Violet Medical Center, we are partnering with the Kwabena Traditional Authority to actually do a blood donation exercise, which the National Blood Bank is supporting. They're going to come and take some samples so that we can stock the blood bank. You know, Domi Kwabena is the largest constituency in Ghana.
Oh, okay.
You know, yes, and so obviously, if the population is so large, it means that our demand for blood is also significantly larger. And so the community is coming together to donate blood so that we can stock the blood bank so that they can also support us when we need blood service. Of course, it's also a service to the whole country because when there's blood available, everybody is going to get their share.
Right.
So that's what we are doing on the 24th. That's this Saturday, from 9 a.m. to 3 p.m. with the local, with the traditional authority in full support.
Okay, right. Nia Bladi Amisa, you are representing the Kwabena Traditional Authority.
Yes.
How important is this exercise to, Kwabena?
Yeah, it is very
area?
important. At the moment, I want to say some greetings to that of our traditional authorities over there. Na Kokwe Dubate, Kwabena Queen Mother, Niabo Kamfran, the third Kwabena, the chief of Kwabena. Yes, and Ni Tete Kwaku, the Shipi of Abola. Yes, this important program that they are going to have is really going to help us very well. Because one, I really want us to put measures in place that the information will go down very well to that of the people in the community. Well, from the look of things, as Doctor was saying, you can see that people, when they call like, oh, we are going to donate blood, and they're like, oh, okay, well, those things, you see that. So from here, we have been able to give out information, one to that of the mosques and also to that of the churches very well, and the traditional authorities and the localities over there. That this is what we are going to do in order to help the blood bank, as they call it. Now, the youths in the community also have been informed that we have to organize ourselves, that we have Kifit clubs, okay, and we have other associations, so that we can liaise with that of the blood bank, and now they can donate. They will not wait till it is time to donate before they will go. Okay, we can do it maybe on 6 months or 3 months, first quarter in every year, and then. So if there's any problem and we go there, as Doctor was saying, it is not good that you go there, you will not donate blood, and now somebody have gone there 6 times to donate blood, and if the person is having a problem, you think they should give that person's blood to somebody else. No, it will not happen. You see that? So since, as he's saying, one of the biggest constituency in that of the community, or the whole Ghana. So if we are able to put measures in place very well, I think it's going to help us.
Right.
Yes, it's really going to help us. And I'll also advise our Madam Sophia, yes, that time and time will come and give some education to that of the people in the community, especially the Kwabena community and its environs, that this some of the things that when they do, it will go down very well to the people, especially at the churches. Okay. Yes.
All right. So,
Can I ask?
Yeah, sure.
Okay, so I would want to use this opportunity to, like he rightly said, it's a big constituency, and then we would make use of the opportunity. This month happens to be World Blood Donor Month, okay? And so it falls in line with what Dr. Kelvin is doing with Violet Medical. We are so grateful. It's a month of love. Aside February, that we know it's Valentine, it's a month of love. So we are thanking all our voluntary blood donors worldwide, in Ghana here too, and then encouraging them to continue donating blood, because without them, all that we are talking about is meaningless. Without them, in fact, they are really doing well, okay? And then we are encouraging those who are having some fears too. Most of the fears are generally unknown, okay? But then we say that just break that fear. Come. When you come, we'll have something special today that you see, that it is not really cumbersome. It's not really something that you say, I would not be able to do it. You can do it if you decide to.
Yeah, maybe the fear of, taking all my blood and I just fall. All right. So, Dr. Owusu, basically, I just have one question. How many times can you donate in a year?
Well, at least 2 times, but you can actually donate more. I mean, but at least minimum.
And it doesn't
twice.
affect you?
It shouldn't affect you because your body is producing red blood cells every time, and the red blood cell lives about 120 days. So really, every 120 days you can donate blood, but let's say twice a year is fine.
Or 3. So once every 4 months,
Yeah.
one can actually donate blood.
All right,
okay?
so talking about donation of blood, we have Kweku on the other side of the studio that is about to, donate some blood. But Sophia, you're going to take us through this process because I'm
Exactly.
sure there's a process that is
Yes.
supposed to be known for this procedure.
Okay.
Yeah, so
Yes.
please let us know.
Thank you. So we have our nurse Jennifer who is there. She's taken David through the questionnaire.
Yeah.
We have the process is 4. The first is the registration. Okay, so we ask for personal details, and that is what she is doing now. After that, then we'll do the medical assessment to check whether the person's BP is fine. The person wants to donate blood. Is his blood level okay to give? For male, the minimum is 13 grams per deciliter, and so we'll check whether he's there. We'll check the person's pulse, whether it's okay, it's fine. Then we take the person through some questionnaire. So the questionnaire is targeted at 2 things. The donor should leave the center as he came. Okay, so he should be fine. So if there are underlying causes or underlying cases that will prevent him from donating, that is where we ask the donor. Okay, and then the recipient should also receive the blood to have an improvement of his or her life. Okay, so these are the basic 2 reasons why we take it. And so that is the second process that they are doing. So that is the medical assessment. We want to check whether he is fit enough to donate blood.
Fit.
Fit
He has to be
enough.
fit first. Yeah.
Fit enough. And you should be 17 years to 60 years.
Okay.
The donation age is 17 to 60 years.
Not younger than that.
Not younger than that and not older than that.
Right.
For older, some people might be, if they are already in the system of blood donation.
Right.
So some people have donated 40, 50, even 100, 130 times, and they are still donating blood.
Right.
And so if your system, your body has donated enough, we have donated blood for a number of times, then we can ascertain whether you can continue donating after 60, but then the age range is from 17 to 60 years.
Right. Are there any medical conditions that can stop you from donating?
Yes, please.
Such
there are.
as?
Such as if you are diabetic and you are on medication, you can't donate blood. If you are asthmatic and it's pretty severe, so we'll ask you, there are some conditions that we'll ask further questions, we'll probe and see if you can. If you are asthmatic, you can't donate blood, okay? If you are sickle cell 4, if you are a trait, if you are AS, you can donate blood. If you are SSSC, you cannot donate blood.
If you're AA, you can, right?
You can, sure,
Okay.
you can. So I guess you can donate blood.
All right, so usually, how long does the process take?
So all in all, including registration, everything, up to about 15 minutes, you should be done, including rest, you should be done. So the
Rest?
actual, including, yes, just a little rest. As soon as you finish donating the blood, you don't get up.
Oh,
Yes.
why?
So we have taken some fluid out of your system, so it can cause a little imbalance.
Right.
Yes. So as soon as you are done, you rest for like 2-3 minutes. It depends on each individual and their system. But all in all, when you put everything together, 15 minutes should do.
Right.
The actual donation might take up to about 5 to 8 minutes.
Yeah.
Yes.
And if you're donating, how many pints of blood are you going to be taking away?
So usually now we prefer using a unit of blood. Okay. So we have a bag. So David is now going to the bed. It means that he has finished everything that needs to be done. His BP is fine. His HB is fine.
Wow.
Yes.
Okay.
Good.
He's
So
a 51
now
months.
we are now going to actually take the blood, which is called the venesection, or we are now going to,
All right.
going into his vein.
So earlier
to
on,
check.
earlier on, you said after the blood is taken, he needs to rest.
Yes, it
So-
is part of the process.
Okay, so after the rest, what happens to the rest of the day? Do we have to give him any special food, any special drinks?
So fortunately for blood donation, after you get out from here, you can go and do anything that you want to do.
Okay.
Just that if it is strenuous, it will give you a lot of sweat. That is where we say that rest a bit today. But then generally your normal routine, you should be able to go and do.
Okay. I just wanted to be sure, as
Yes.
David is my...
Yes,
No.
David should be able to go on
Exciting.
doing his
Yeah.
business today. Yes, he should.
Okay.
So now he's coming to clean the area and then look for the vein, and we'll start the donation process.
Okay.
As much as possible.
Is it painful?
It's painless. If we say painless, when you are donating the blood, actually you are lying down. I wish you can try it one time. If you are donating the blood, it is not painful. It is just the initial pinch that you feel, but after that you don't feel any other thing again. Okay. So I might want to, yes, so now we are entering the vein. She's seen it easily. Oh, she has started. He has started. So we've started. So we might want to add that before you even come, we ask that you take in a lot of fluids like water, non-alcoholic beverages. It's very good. It helps open your veins. It helps you really. So when you come, you don't really keep. You don't stay there longer. Okay.
So what are they giving him to read?
So it also shows that blood donation is really a simple exercise. You can scroll your phone, you can read, you can do anything when you are down there. So it's a relaxing. So
is it like exercise. A form of distraction?
Oh no. So there are things there that does and don'ts of blood donation. So after donating blood, what are you supposed to do? What are you not supposed to do? Okay, that is it. So that is what I was telling you, that before donation, we encourage that you drink a lot of fluid, and after donation too, you still continue drinking your fluids.
Right. He seems to be smiling. That means it's not painful at all.
It is really not painful. A lot of people assume it to be a very painful exercise. It is not. The initial pinch is what we'll feel, but then afterwards it's really painless.
Wow. He definitely is going to have a special treatment today for, contributing and saving lives. Okay. So like you said, it takes about 15 minutes and then you're
So the
done.
15 minutes starts with the registration up to where the donation is taking place.
I have another question now. So what if people do not disclose their, on any underlying illnesses? What happens?
So basically, that is why I told you that the questionnaire is targeted at two things. To make sure the donor is safe and the recipient is okay. So if it's voluntary donation, what I have seen is that a lot of people
just open up.
They will open up. The problem comes when it's a replacement donation. Replacement donation is also a kind of donation. It's me coming to donate for my relative or friend. Okay. And I know that my mother is lying there. She needs the blood. And because of one condition or the other, I cannot donate the blood, and there's no other person there to donate. So even if I have a headache, if I have ulcer, if I have something, a condition, when they ask me, I'll try as much as possible to hide it and then come and donate, because there's really nobody to give. But then if it's voluntary, like he's here, he's coming to save somebody. So normally they would open up and tell us what is happening, so that the necessary advice we give to them. So we can disqualify. Disqualify is a harsh word. We can defer our donors depending on what is happening in their lives. Okay, so sometimes 2 weeks, sometimes 4 weeks, sometimes 3 weeks, sometimes 6 months. It depends on what the condition is, and some of them will not be able to donate at all.
So do the bloods get tested?
Not here, but after the donation, then we get to test the blood that we sent.
So when you test the blood of the person that sent it and there's a problem with the blood, do you contact the person later and say, hey, okay, you donated blood last time, but we need to tell you something that you probably don't know?
Yes. So there is a consent. If you want to know, we will tell you. But they generally,
I think you have to.
Yes. Some people will not know, and then it is their decision. Honestly, it is their decision. But as much as possible, we will contact you.
That's if you want to know.
Yes. exactly.
Whew.
Exactly.
That's a lot.
So you know, in other countries, they would prefer to come and donate, and then after that, they would actually come and tell you that, oh, so after donation, do you have anything to tell me? Should I expect a call? You know yourself,
Yeah.
okay. But then, so you call the person, you tell the person, and then there's a relief. Sometimes you invite the person to our premises, and then it's a chat,
Right,
and then
right.
we converse.
Right.
Okay.
Okay. All right. Seems.
Yes,
Oh,
so
that's a lot of blood.
Jennifer is trying to shake it. You know, we have a substance, an anticoagulant inside the blood bag. It's a substance that would prevent the blood from clotting. You know, usually when blood comes out, it clots. Okay, so she's shaking it so that it will get mixed up with the blood, and then there will not be any clotting in the blood.
All right, so the blood donation is going to be happening on the 24th of June 2023 from 9 a.m. to 3 p.m. at the Musuku Roundabout, Kwabenya. So if you want to be part of it, I think, in fact, not if you want to be part of it, you actually have to be part of it. Yeah, you should be part of it because you could be saving a life, all right? And this is a very crucial act of kindness. So it's important for each and every one of us to do this, okay? Okay, so before we wrap up, we actually have a birthday message here, and the birthday message. All right, so it says, I pray for more of God's blessings in abundance and grace upon your life. Happy birthday, Abdullah Salimatu from Theophilus and Mary. And we have another one. Happy birthday, Madam Angelina Afiefa Mensa, Office of the Administrator of Stool Koforidia. Your husband Frank and the children Akosua, Pa, Ahin, and Elikem says, may you live long and continue to be a good mother. Happy birthday. Anyway, I want to say a very big thank you to each and every one of you for joining us. And you know, this is a very important topic that we needed to have. And thank you for all the clarifications. Thank you, Dr. Owusu. And I'm sure David is all right and he has donated blood. So yay! David, thank you so much for donating blood, and thank you so much for, you know, contributing to saving someone's life. You can also do that. So try and be a blood donor. If you haven't done that, try and do that this year and mark that out of your checklist.